Dude, I read that whole, this SOB, and I said that to him. I read that whole thing. And the last 2 or 3, I just scrolled past because I was like, what has happened to money here? He's lost his mind. And then he hits us with that one at the, it's the last one. I wanted to start off with COVID, everybody's favorite, because I read a post today, Billy, that I think it got me all pissed off. And then it brought me back around. It's no secret what I think about COVID. Everybody knows that there were easier, better, faster, more expeditious ways of dealing with COVID. And I talked about it. Not that I'm anybody, but I talked about it in probably, if we go back and look, I'll bet you it was March, maybe early April last year.
Yeah,
about how to
like
deal with them, how to separate old people from young people, and what kind of money could be spent compared to what kind of money was spent. Did I tell you, just as an aside, Billy, that we spent, that of the checks that were sent out, that the government sent out, that 100 million people got a check that weren't impacted by the lockdown?
I believe it.
Yeah. 100 million people got multiple checks that weren't affected by the lockdown. It's just insane. So here's this guy's blog, here's this guy's post. I want to read it. It's going to take a second here. It's multiple pages. But I thought that I follow these guys in Tennessee that kind of keep track of all of this stuff and provide numbers. And the dude is pretty good about it. Open the schools, get rid of the masks. If you want to get vaccinated, go get vaccinated. Good for you. If you don't, good for you. Really kind of, I suppose it'd be a conservative take on it in the world we live in today. But to me, it's a much more reasonable take. So here it is. It says, I think I need to rethink things. People have been shaming me and others for speaking up against the COVID-19 panics. Hospitals are overwhelmed. They might be right. I have to share some quotes about our hospitals I've been reading. Quote number 1. These are actual quotes from pieces I've just read. I don't know why I've been ignoring this. Let me say that I'm serious about my respect for frontline workers. I'm confident they are not the ones calling for us to lose our jobs so that they can do theirs. Politicians did that. Talia writes in and says that his hospital is managing, but just barely keeping up with the increased number of sick patients in the last 3 weeks. The hospital's urgent care centers have also been inundated, and its outpatient clinics have no appointments available. Dr. Bernard Cummins, an associate professor of infectious diseases at the University of Alabama in Birmingham, says that the UAB hospital canceled elective surgeries scheduled for Thursday and Friday of last week to make sure more beds were available. We had to treat the patients in places where we normally wouldn't, like in recovery rooms, says Cummins. The emergency room was very crowded, both with our sick patients who needed to be admitted. In California, several hospitals have set up large surge tents outside their emergency departments to accommodate and treat patients. Even then, the LA Times reported this week emergency departments have standing room only, and some patients had to be treated in hallways. In Fenton, Missouri, SSM Health St. Clair Hospital has opened its emergency overflow wing, as well as all outpatient centers and surgical holding centers to make more beds available to patients who need them. Nurses are being pulled from all floors to care for them. It's making their pre-existing conditions worse, she says. More and more patients are needing mechanical ventilation due to respiratory failure. From Laguna Beach to Long Beach, emergency rooms were struggling to cope with the overwhelming cases and had gone into diversion mode, during which ambulances are sent to other hospitals. Hospitals across the state are sending away ambulances, flying in nurses from out of state, and not letting children visit their loved ones for fear they'll spread. Others are canceling surgeries and erecting tents in their parking lots to triage the hordes of patients. There's a little bit of feeling of being in the trenches. We're really battling these infections to try to get them under control, Dr. McKinnell wrote in. We're still not sure if this is going to continue. At Parkland Memorial Hospital in Dallas, eyes aren't working. Waiting rooms turned into exam areas as medical tent was built in order to deal with the surge of patients. A Houston doctor said local hospitals' beds were at capacity. A Dr. Anthony Marinelli says they've seen a major spike in cases. It's so overwhelming, the community hospitals, that they've gone on bypass at times. That means that they tell ambulances to bypass this ER and find another one. A Dr. Atala, the chief of emergency medicine at Grady, says the hospital called on a mobile emergency department based nearly 250 miles away to help tackle the increased patient demand. At 500 plus patients a day, you physically just need the space to put a patient in. We've never had so many patients, says Adrian Cotton, chief of medical operations at Loma Linda University Health in San Bernardino County. At least one hospital has set up an outdoor triage tent to handle the overflow of people. In Long Beach, hospitals have started visitor restrictions. In the South Bay, a conference center has been transformed into an ambulatory clinic. We have signage set up all over the hospital to inform patients that, if they have any family members with even signs of symptoms, not to visit. Loma Linda emergency physicians are seeing about 60 more patients a day than they usually do, Cotton said. About 150 patients have so far been treated in the tent, which is staffed according to the number of people inside. It's expected to be up for months. As the main emergency room gets full, patients are moved to the tent. For example, a patient who comes in with a broken arm is likely to be treated inside the tent, he said. Visitor restrictions have also been implemented. The county saw a 300-person increase. Overflow tents have also emerged in San Diego County hospitals, though they haven't pitched tents. Most hospitals across Southern California have set up overflow areas inside of their facilities. Our workers are incredible and know they've been trained to deal with this, but maybe the lockdown folks are correct. Maybe we opened up too quickly. Maybe we should stay in shutdown mode. I mean, nothing like this has ever happened to our hospitals before. Our workers are incredible, and I know they've been trained to deal with this. It meant nothing like this has ever happened to our hospitals before. Pretty brutal, huh, Billy?
Yeah.
There's one more quote. All of these quotes, healthcare workers are amazing. I know they can do their jobs without the rest of us having to forfeit our lives. I think we should end lockdowns. I think we should get kids back to school. I think we can get our hands around this. Why? Because all of those quotes are from the 2018 flu season.
Yep.
Dude, I read that whole, this SOB, and I said that to him. I read that whole thing. And the last two or three, I just scrolled past because I was like, what has happened to money here? He's lost his mind. And then he hits us with that one at the last, and it's the last one. And it reminded me of, we've gone over this before, how they instructed the people to deal with the Black Death, the plague back in the day. In Europe and specifically in London. And if I'm not mistaken, it was the same thing they were telling people to do for the Spanish flu in 1918, which is, so you got the Black Death, the plague shows up in Europe in the mid 1800s and wipes out God knows how many people there. And then here, 75 years later, the same thing happens, only it's, in this case, the Spanish flu, and it wipes out 50 million people. And in both cases, and in many cases throughout history, the powers that be told their constituents to wear a mask and to separate themselves. So social distance and wear a mask was the way to fight the plague in whatever year that was, 1860. I don't remember what it was. And that is the same advice that they're giving today. So I thought that was kind of interesting. That reminded me of that.